Hey, have you ever been told that you have a bulging disc? I have, and it can be kind of blinding. And what do I mean by that? If you're told you have a bulging disc, it's hard to see the big picture. What I'm going to try to do is hopefully explain and show to you all what that means and why sometimes it's not something to be so concerned about. I'm Dr. Cole with Mid-Atlantic Chiropractic. I'm going to be going through what a bulging disc looks like and the difference between that and a disc herniation, which can be kind of serious. So let's start out by showing you what a normal spine should look like. So a normal spine that's nice and healthy, it should have these nice fat discs here. And inside of this, we have what is known as the nucleus pulposus. Oftentimes is referred to as a jelly donut, but in reality, the outside of this disc is very hard. If you ever watch a spinal surgery, you'll see that they're in there ripping and tearing and moving things around, and it does stay very stiff. When we talk about what a disc bulge is and what it may mean in your case or in my case, this annulus fibrosus is actually seeping out a little bit. Not the nucleus pulposus, but this hard outer layer. And why is that not a big deal? Well, it can be, but in most people, you can be asymptomatic, meaning that we can have multiple bulging discs and not even know about it. And in fact, most people don't even know they have a bulging disc until they become symptomatic or until they have an MRI done. What is the difference? So when we're taking a look at this vertebrae here, which does have, in fact, a bulging disc compared to a normal healthy spine, we see that this part is kind of sticking out like a squeezed out Oreo. And then here we see, indicated by the red, the nucleus pulposus actually seeping out into what is known as the intervertebral foramen. Why is that a bad thing? That's a bad thing because that's where that nerve exits from. And the majority of these disc herniations occur in the posterior lateral portion of the spinal canal. And so what happens there? Well, this big pasta looking thing right in the middle, that is your spinal cord. And the branches out here, these are your spinal nerves. And so if we take, for example, the nerves in your neck, if one of these branches is being contacted, it can cause sharp shooting pain from your neck all the way down into your shoulder and into your fingertips. So that's a major sign that you should either go to the chiropractor or go to your doctor to see exactly what's going on. When it comes to a disc herniation, what happens is this nucleus pulposus, it's seeping out, it's touching either that spinal cord causing a protrusion, or it's actually touching one of these spinal nerves. And so what does that look like? Oftentimes it can be things like sciatica, which is why it's a good idea never to sit on your wallet if you're a guy, because that's going to push up your pelvis, and in the long run, it's not a very good thing. When does a disc bulge happen? When does a disc herniation happen? Well, disc bulges, they don't necessarily need any kind of cause or mechanism. A lot of times it's just compression, whether it be from sitting all day in a bad posture with your shoulders forward, driving a lot, and just being a normal desk worker. And that's from the compression of these vertebrae over time while you're sitting in a malposition or a bad position. A disc herniation, it can occur with trauma, but can also occur with simple movements, such as picking up weights at the gym, picking up a box at your house. And so knowing the difference and knowing when to go see someone is very important. Now, a lot of the times when you have a disc bulge, as we see in this one here, what you really need is stability. So a lot of the times, if you go to a physical therapist, they'll have you doing things to strengthen both your core and your back. What do those things look like? Well, they can be anything from planks. A lot of times they use something called Williams and McKenzie flexion and extension exercises. Depending on where that bulge is and the laterality of it, the direction of it, is going to be depending on what you have to strengthen. When it comes to a disc herniation, a lot of times what they do, or what we do, is we actually do something called decompression. So we're actually opening up that joint space, allowing all those good vital nutrients to come back into the disc space. And oftentimes you can do this through a process of imbibition. So if you've ever been recommended a wobble cushion, it's something that you kind of sit on and go side to side. That's going to be pumping fluid back into that disc. And so what should you do next? How long does it take to heal something like this? Well, the truth of the matter is it really depends on the direction of that bulge. Is it a bulge? Is it a herniation? Does it have to be surgical? The majority of the time when it comes to bulges, they don't have to be surgical. A lot of times, like I said, you can just stabilize that section. And when it comes to a disc herniation, sometimes that is surgical. And sometimes you'll be prescribed either medication, a steroid, or something to bring down that inflammation. What can we do as chiropractors to help you? Well, the number one thing that we need to make sure of is that your spine is in a proper alignment. It's nice and straight. Weight is being bared on the posterior elements and these facet joints back here, these big dinosaur looking things, and making sure that you're not tilting too far forward and pinching off that disc, or in your low back, most commonly at L5, S1, pinching off the disc in the back. And so also, if you've ever been diagnosed with scoliosis, we can put a lot of pressure on the lateral aspects of the disc. Through chiropractic adjustments, us getting your spine back to a normal alignment, we can definitely take off pressure, not only on the nerve roots, but also on the disc itself. When it comes to a disc herniation, a lot of times we need to do decompression like I talked about. We have something known as KDT. It's a traction table. Sometimes they use it in physical therapy. And all we're doing is slowly, with mechanical traction over time, wearing a belt on the table, we're decompressing that vertebra and where that disc is. And so there's a lot of famous stories about athletes getting injured, whether it be a disc bulge or a disc herniation. Tony Romo was a big quarterback that had a big injury a couple of years ago, back when he was still playing. And so they can be serious. It can be confusing at times. It all depends on the direction of that disc bulge, direction of that disc herniation. And so if you really want to know, the best thing to start out with is we'll take an x-ray, we'll take a look at your spine, see what that alignment looks like. And if you are having radicular pain, numbness, shooting, radiating pain into the arms or legs, that's when maybe an MRI might be warranted. We might go that route. And then from there, after talking to your other doctors, we'll determine what the best treatment method is for you. But number one, the best thing you can do to help prevent a disc bulge and a disc herniation is always doing your range of motion exercises. And the neck, we want to go lateral bending, side to side, extension, flexion, and rotation. Same thing in the low back. So we're doing lateral bending, rotation, rotation, extension, and flexion. That's going to be the best thing for you. Making sure that spine stays mobile is going to be important for preventing degeneration in the future. One last thing I wanted to go through are what are the stages of degeneration? What do those look like? A normal healthy spine is going to have these nice blocky vertebrae, no irregular borders. Once we start to see disc bulging start to occur, we'll see something known as lipping at the top. And that lipping, if left alone, turns into spurring. And so have you ever been told you have a bone spur somewhere? Well, bone spurs are pretty common in the spine, and they're known as osteophytes. And so osteophyte production, that's what that sharp, irregular edges on the vertebra, and those times if they go into the spinal canal or they touch one of these nerves, they can be painful. This is what would be considered phase 2 degeneration. Phase 1 degeneration, we might see that disc space narrowing, and then once we get to phase 3, that's when things get real messy. We see that this nucleus pulposus is all over the place. It's leaking out into the IVF, and we also have massive bone spurs here. Now, the next step after this is fusion, and once these two bones are fused, we can't move them anymore. So it's very important to make sure that we don't get to phase 4. Our job is to keep you in phase 1 as long as possible before we get to phase 2, and then from phase 2 to phase 3. If this video was helpful, please like and subscribe. Please leave a comment if there's anything that I could explain better in the next video, and we look forward to seeing you guys next time. Thank you very much. I'm Dr. Cole with Mid-Atlantic Chiropractic.